The Public Health Agency of Canada is warning about an uptick in norovirus cases, saying it's spreading at a higher frequency than expected, especially in Ontario and Alberta. CTV's medical expert, Dr. Marla Shapiro, joins me now to discuss. I'm going to try to get through these next 4 minutes without wincing.
It's really no fun.
It's not fun. What exactly is norovirus and what are the symptoms?
So it's called Norwalk, and a lot of people associate it with cruises when you hear about gastro outbreaks on cruises. So of all of the stomach flus and viruses that can lead to a gastro, this is among the most common. About 60% of the cases of stomach flu that we see are generally caused by this. And we don't typically screen for it because it's self-limited, but we do screen for it when there's an outbreak in one location. So that gives us the trends, but it doesn't really tell us what's happening in the general population. So in terms of it being contagious and the symptoms, it's exactly what you would expect. Stomach flu, so you get lots of nausea and vomiting, loose stools, abdominal pain. You can see fever, fatigue, headache, and body ache. Typically, it's about 12 to 48 hours after you've been exposed, so you may not know you've been exposed, but if you're living in a household with someone, good chance you've been exposed. And then those symptoms are generally worse in the first 2 to 3 days that you have this. And the symptoms are really no fun. And we'll often see it starting with one child in a household, and then it just takes off in terms of the entire household.
It's kind of a super spreader, isn't it?
It really is very contagious and not a lot of fun. There's no upside here, really, that I can tell you.
Okay, in terms of trying to slow down spread, washing your hands, I mean, is anything going to help?
Well, there are things that help. So the mode of transmission, we think of as being fecal, oral, so contaminated hands to contaminate a mouth. That's the way it can happen. We think about surfaces. So often when we think about their surfaces, we think about cleaning a surface. But this virus really has what we call a hardiness. It really does not like to disappear. In terms of alcohol-based surfaces, washing with alcohol-based or using an alcohol base for your hands, it doesn't do it. It's still there because it is so hardy. So you really do have to wash your hands. And I remember, teaching people, sing the whole stanza of Happy Birthday to You, wash your hands with soap and water. It's not enough to use any of the alcohol-based wipes. You really have got to scrub really, really well to avoid that type of exposure. And you can think that if you're a parent taking care of a child that has this, it's a little bit difficult to do.
So if you do get it, is there a treatment?
Well, the first thing is that know that it's usually self-limited. So keep that in the back of your mind.
What does that mean?
And it's going to get better on its own.
Oh, okay.
Usually you're just riding it out. You want to make sure that you're really hydrated. If you do keep things down, taking an anti-nausea pill or an anti-nausea suppository, if you don't keep things down, may possibly help. Where we really get concerned is, as usual, in the very young, the very old, we worry about dehydration. So in those two groups, you really want to make sure that they're getting enough fluid in, which can be very difficult if you're, have a lot of vomiting. So we recommend, clear sips, take a teaspoon or two, wait it out another teaspoon or two. But, we often say this too shall pass, but you are going to be miserable in the journey.
In the journey. Why are we seeing a spike in these cases?
We're seeing viruses behave a little bit differently. Remember that during our social isolation with COVID, nobody saw anybody. We didn't even see flu. We didn't see RSV. Many of these illnesses just didn't spread because we weren't in close contact with each other. We're out and about and we're seeing a resurgence. The numbers are sort of what we typically see in a pre-COVID period of time. But, they're resurging after a year or two of not seeing them, so they're making headlines.
And you mentioned kids and seniors, and I know there's usually a lockdown when norovirus is in a senior's home. Can this be deadly?
Well, if you're dehydrated enough or you have enough comorbidities or you're really ill, this can be something that tips the balance. So yes, in the very young and the very old, you want to watch that hydration status. And the reason we have lockdowns is because it's so contagious and it's difficult to clean those surfaces fast enough to eliminate the exposure.
Dr. Marla, thank you so much. CTV's medical expert, Dr. Marla Shapiro, joining us this morning. Appreciate it.